Well, thank you again for this honor to talk. I'm going to talk about health information technology, or HIT, and as it's being promoted in medicine, but most specifically in obstetrics and gynecology, one can ask the question of why should we use it, and I'm going to try to answer such questions to perhaps be convincing. I have no financial conflict of interest, and as you all know, we've had introduction of many acronyms in this space, in this area of HIT, to use another acronym, and it has created a lot of confusion, but I will try to address some of the issues that are pertinent. I'm going to talk about meaningful use, and that's a term used in this country trying to promote the use of HIT, of using computers in the practice of medicine. And there's been a federal, an American federal incentive to use these technologies, and I'll talk a little bit about that as it affects us all. I will talk about specifically the current HIT use in obstetrics and gynecology, speaking of its downside as well, and certainly of what value there may be, and how all of our respective workflows can be affected. Well, the American College of Obstetricians and Gynecologists, ACOG, put out a committee opinion 5 years ago extolling the virtues of HIT, saying that the use of the electronic health record as a real-time evidence-based support tool can help busy obstetrician gynecologists improve the quality of care they provide through improved care coordination, communication, documentation. That all sounds very good, and I suppose time will tell to see if there is truly the value that is stated in this committee opinion. It is my opinion, of course, being in this, working in this world of informatics, that this is in fact true. Well, a couple years before that, because of the Institute of Medicine reporting in 1999 how many deaths were caused iatrogenically by physicians because of medication error and a variety of other problems, came the introduction of the electronic health record to avoid that. So the committee opinion from ACOG said, okay, let's use the health record to lessen the likelihood of medication error, because it was shown to be true. So we had a growth of electronic systems in obstetrics, and there's all kinds of brands of products that have been used over time. I suppose I could mention, while I stated there was no conflict, once upon a time I did work for Peregrine. They created an OB software tool that was very good, but and is even being used by some hospitals today. We all know about the need to transfer the prenatal record from the ambulatory space to the intrapartum inpatient space, and there are a variety of technologies that promote that, and that's something that we all must use. There has been the growth of many databases for tracking perinatal data, and I created one, and I spoke a little bit of it this morning earlier. The components of the electronic health record includes, I won't read all of these, but it goes from nursing documentation to vital signs and so on. All of these things, these components of the electronic health record contribute, all these different components combine to the electronic document that we called the electronic health record. Well, it offers some ease, because when in the inpatient space, physicians will order things, laboratory tests and orders for the patients, and we can do so by simply clicking on various items, and then voila, we say okay, and it gets done. This is as compared to once upon a time when we all scribbled on paper, but no one can read those things. Well, there is some danger in the hybrid state because many hospitals, as they grow to include the electronic record, we sometimes have both things on paper and things electronically, and it creates a great deal of confusion, to say the least. We also have to make sure that when we talk about the health team, that everyone is included, including those that will see the electronic portion of the medical record. We have to always remember that there is a requirement of training with any kind of system that's used, and if anything changes, well, then you have to retrain. So this is something that needs to be considered investing in the adoption of any kind of a system. We also have to recognize the learning curve, that it takes time to learn these things and to be fluid with these tools, and we have to recognize that. In other words, everyone isn't up to speed in one day, to say the obvious. And when we all have systems, computer systems, I witnessed it where a physician wishes to put the record put the notes into the record, but they have to stand in line because there's only one computer available because, well, we have to plan, in other words, plan for this technology adoption. I always like showing the example of the scribbling I'm speaking of, and I really can't read this, but this is once upon a time, back in the day, I could say, we would, and Katie remembers when there was a time when we would have such scribblings being passed off. So there's no wonder that medical errors occurred. How could they not? That's basically self-evident. So we know that there's value in the clinical value in the HIT tools we use. The legibility is kind of one obvious thing, but the fact that clinical decision support, or what we call clinical decision support, is available with these electronic tools, because when I would be writing an order for ampicillin for a patient who was allergic to penicillin, well, okay, I forgot, but I didn't have somebody tapping me on the shoulder saying, the patient's allergic. But now you get an alert so that I don't have to remember somebody is, and that we believe that there is great patient safety that goes along with the use of clinical decision support. We have an increased amount of information that we can gather electronically, and this is useful because we have the ability to look at our patient outcomes and see what things work and what things don't. We certainly, as a rule then, we can identify the best practice, what we know may turn out to have better patient outcomes, and if we standardize it and expect that to be followed, this best practice, we think that's a good thing. We certainly can improve the quickness and efficiency of how we operate because we have the availability of those electronic tools. And we also know that we can be given alerts when we prescribe something if somebody sees that there's a drug interaction that is potentially harmful. We know that we can use these tools for improving our reimbursement. We also note that such reporting of our behavior can give rise to quality reporting because we can all look over each other's collective shoulders to make sure that there is indeed quality being delivered, quality care being delivered. We recognize that while once upon a time it may have been true that a physician was responsible for delivering the care to that patient, we recognize that today there's really a healthcare team that delivers this care, and having a tool where we can all contribute to that is useful. We also know that patients have to be engaged in their own care, and so we now have seen the growth of the patient portal so that patients become aware of all of the things that happened to them while they were under our care, and that is also to the benefit of patient health. Now, if one were to dictate a note, it will work like this. In other words, speech recognition software where someone can dictate and see the words on the screen is a tool that we oftentimes use, this so-called speech recognition technology. One of the brands that we use is Dragon, but this is something that makes it easy because once upon a time, well, still happening actually, physicians may pick up the phone and dictate their operative report. They will get the paper report back maybe in a day or two, and then there'll be some things that were wrong, and so doctors should scratch off the word that was wrong and substitute it, but that never happened. So the reality is that with this real-time tool, if we use it in this way, we can be not only more efficient with our time, but actually be more secure in the information that we're putting into the health record. I did a study. I've been involved in informatics, this area of using the computer in healthcare for quite some time. So I remember a time when I had to convince doctors to quit scribbling on paper and use the computer. It was a lot more difficult once upon a time. But one of the studies that I did looked at turnaround time. Now, turnaround time is basically when you put an order for a medication and when did that patient actually get the medication. So when we did it on paper, I compared it when the order was placed on paper versus clicking on it on the computer, and compared the time that it took for the medication to actually be administered to the patient. And lo and behold, we found that electronic ordering had 1/3 the turnaround time as paper. This is one of the things I use to convince people. Well, over time, I guess it worked. So that's just to show that there is some basic value in using our technology because of the smartphones that we all use, and we can take pictures and everything. Or we can navigate to a certain place that we've never been. Or there's a lot of societal change that has occurred with adoption of technology, so it's about time that physicians employ those same things as well. So we can talk about societal slowness. Back in the day, there was smoking on airplanes in this closed space that, there's passive smoking, therefore. And we all have seen the harm in that, so it took a while. Well, it took a while, but now you can't smoke on an airplane. And so that's an example of it's about time. Or seatbelt use. We convinced people that lives could be saved if we use seatbelts, and now, well, it's the law. So this is, but it takes decades, actually. But I liken this slowness because I have to defend physicians when they say physicians are so slow to change. I can say, oh yeah, well, what about, anyway, that's so, so basically when we speak of our advancement of our medical culture, we have to look back in the Stone Age, and with an eye to the future and recognize what value there could be in adopting these technologies to advance our health and women's health care, well, all health care, but I'm an obstetrician gynecologist, so of course I'm going to talk about women's health care in this regard. There's a thing we all learn, primum non nocere, first do no harm. I made up another thing mainly caveat medicus, let the doctor beware. So we should all beware of all of the things that we get ourselves into. If there are any specific questions, I can be reached here. Thank you.